The Parliamentary Standing Committee on Gender Equality, Social Development and Family Affairs, which is tasked with the mandate of overseeing health-related issues, should spearhead and identify efforts aimed at reducing the effect of this disease. Serious illness such as TB continue to be the cause and suffering of many of our Namibian people. This should feature prominently in our oversight responsibilities as members of Parliament. Members of Parliament should be willing to become advocates and raise awareness among our communities, especially at the grassroots level. We should be able to make sure that every patient should receive quick and accurate diagnosis and high equal treatment in order to prevent further spread of the disease or even death.
I listened to the testimonies and motivational speeches. I found them quite instructive because one of them stood out for me, that she has been a patient who was on treatment, then went back, finished her treatment, and then developed drug resistance, TB. Put on treatment again, finished, then developed multi-drug resistance TB. And she's still under treatment. Now, it strikes me that, yes, it's good to have the medications and treatment, but we also need to address the source, the cause. Because if she goes back to the same community, the same people who may have the infection, she's likely to be reinfected. But unfortunately, this time, getting reinfected with drug resistance to TB, which is more difficult to treat. Though the Africa region has achieved the first milestone of the end TB strategy, where 20% reduction by the year 2020, there are still significant challenges that need to be addressed. And this includes, one, over 40% of people living with TB did not know of their diagnosis. High TB and HIV co-infections, with approximately 20% of people newly diagnosed with TB and also living with HIV co-infection. And thirdly, low multi-drug resistance TB treatment coverage. In the African region, only 26% of all people living with a multi-drug resistance are receiving appropriate medications and treatment. Ladies and gentlemen, to address the issue of TB, the global targets have set in the SDGs, that is the Sustainable Development Goals, the End TB Strategy, and the 2018 Political Declaration of the UN High-Level Meeting on TB. In addition to target for the 2030, the End the TB strategy defined 2020 and 2025 milestones for reduction in TB incidence and the normal rates. Key elements contributing towards reaching the target include optimal use of existing interventions, achievement of universal health coverage for essential preventions, treatment management and care interventions, as well as efforts to address the social determinants and consequences of TB, including TB-associated impairment and disabilities, are key challenges that need more investment and effort to achieve the goal that we set ourselves for the year 2030. A significant proportion of patients with the disease, about 42% in 2021, still were missed and remain in the community untreated and transmitted the infection. And this is the story that I highlighted at the beginning. Children under the age of 15, older men, and other risk groups, including minors, inmates of correctional facilities, undernourished and informal settlement, and isolated communities need more attention. A huge proportion, that is 82% of households, face financial burden due to the disease, mainly from non-health related causes. Then, drug resistance TB surveillance is below expectation, with low coverage of both the first and second line drug susceptible testing. And lastly, the progressive shrinking of TB funding over the years, both donor and domestic funding, will affect the achievement of the NTB targets.
In Namibia, over the last 5 years, there have been notable gains in TB control, shown by a 28% reduction in new cases and a 17% reduction in deaths. These accomplishments can be credited to the leadership of the Ministry of Health and Social Services and the hard work of health workers across the country. Diagnosing and treating TB was made all more difficult during the peak of COVID, and I'd like to take this opportunity to thank all of the healthcare workers in the facilities and in the communities for their unfailing dedication to improving the health of their communities. So worldwide, TB rates are higher among specific groups: mine workers, incarcerated people, refugees, immigrants. Other groups such as the San community in this area are particularly at high risk for TB. It's closely associated with the medical conditions of HIV, alcohol abuse, tobacco use, and diabetes. Finally, it's intertwined with social factors: overall poverty, undernourishment. To address TB, we need to think about it more broadly, than just health, as well as social services too. We need to think about not just treating a disease, but we're treating communities. With that in mind, I'll turn to the theme for this World TB Day. Yes, we can end TB. It's a theme of optimism. 20 years ago, if someone had said Namibia could control the HIV epidemic, many in the world would be skeptical. But here we are. Namibia, through the health ministry and other ministries of government and communities, is at the cusp of controlling the HIV epidemic, has exceeded all expectations. I have full confidence that Namibia will eliminate TB as a public health threat as well.
Otjozondjupa region, according to the National Tuberculosis and Leprosy Program, the annual report of 2022, our region ranked number 7 in the ranking of regions by disease burden, with 595 notified cases of all forms of TB. The national cases of Namibia were 8,604 in total, meaning Otjozondjupa region have accounted for 7% of those. In July 2022, TB screening campaign was conducted in Tsumkwe constituency, whereby 1,900 clients were screened for TB. 37 cases were susceptible and 5 drug-resistant cases were recorded as well. Similar campaigns will be conducted in 2023 that will be including the screening of inmates and mine workers. A lot of speakers have spoken what the causative agents are. But as far as Tsumkwe is concerned, why Tsumkwe is the one recording the highest cases is because of issues of malnutrition coming from poverty, lack of food at household level. The government of the Republic of Namibia, through the Division Marginalized Community back in 2013, have launched a program of providing food at every household as far as marginalized communities are concerned. And this is because, in the end, the son of Atwe and Ovashimba community, whether it rains or it doesn't rain, without any support as far as food provision is concerned, they will find it difficult to make ends meet. I would like to urge upon the Division of Marginalized Community in the Ministry of Gender Equality and Social Welfare to step up and increase and strengthen their support for marginalized community food program, because it comes in quite handy with medication and assisting tuberculosis in the marginalized communities. Comrade Minister, I must applaud you and the entire staff of the ministry for having provided a gene expert machine at our clinic. It is one of its kind, whereby today testing samples are no more sent to Grootfontein and eventually to Windhoek for diagnosis. But within 2 hours, we are able to detect the presence of causative agents within a patient. That gives us a leverage that that patient will get on medication earlier. So thank you very much, Comrade Minister, for that machine.
Ladies and gentlemen, it's my honor to be here today at the belated commemoration of World TB Day 2023. One of the main reasons we are here today is to further intensify our efforts to combat tuberculosis in Namibia. It is also an occasion for Namibia to join the rest of humanity to reflect on the devastating impact that tuberculosis has had on our country and the world at large. Aim is to get the community involved and to raise awareness about this deadly but treatable and curable disease. This is important because without the involvement of communities, efforts to combat TB or any other disease will not be successful. I therefore underscore the fact that the community must be at the center of this campaign. They must be the focus of efforts and initiatives such as this one we are witnessing today. As far as possible, the community must drive these initiatives. That's why we talk about community ownership, community buy-in and community involvement in health promotion activities. As a matter of fact, progress has been made in the fight against TB here in Namibia and also in other countries. However, TB remains one of the world's deadliest infectious diseases, claiming over 1.6 million lives each year. This is a devastating toll, considering that TB is a preventable and a curable disease. Thus, as in the past, this commemoration must serve to remind us that TB is a major public health challenge facing the world today, and indeed our country. We stand in an unenviable position as one of the top 10 countries with the highest burden of TB in the world per capita. This commemoration, as I said at the beginning, must re-energize us, healthcare workers, communities, policymakers, lawmakers, traditional leaders, spiritual leaders, development cooperating partners, non-governmental organizations, community-based organizations, school learners, farmers, members of the community, individually and collectively. We must unite and join hands to defeat and vanquish this disease. We have the tool to defeat TB. We have the information to defeat TB. We have the capacity to test and detect TB and initiate those infected on effective treatment. In other words, we have the needed and necessary ways and means to once and for all break the teeth and the spine of TB in our society. We also have the will and the strength to win and claim victory over TB. In 2021, an estimated 10.6 million people fell ill with TB. This was an increase of 4.5% from 10.1 million the previous year. Globally, the number of people newly diagnosed with TB and reported to national health authorities increased from 6.4 million in 2021 from 5.8 million the previous year. Statistics indicate that 1 in 4 people, or a quarter of world population, has what is known as latent TB infection, or the germ that causes TB disease. Globally, the number of people who fell ill with TB disease is more in developing countries. In 2022, Namibia notified 8,604 patients with TB. This reflects an increase of 30% from 6,599 cases in 2021. The global TB report indicates that Namibia may have been missing up to 42% of the TB cases based on 2021 estimates. The reported increase in the number of cases as stated above is not necessarily a negative development as it may appear at first glance. On second look, the increase shows that our efforts to close the treatment gap are having the desired effect. In this regard, it is important that all those with TB are found and started on treatment without delay. We must do everything in our power to minimize and disrupt the further spread of the disease. It is encouraging that the current treatment success rate in the country stands at 87%. This is just 3% shy of our target of 90%. The theme for this World TB Day, as has been mentioned by previous speakers, is Yes, We Can End TB. This theme should inspire hope and galvanize high-level leadership to engage and prosecute the fight against TB with the necessary fortitude. This year is critical, with the opportunities to raise visibilities and political commitment at the 2023 United Nations High-Level Meeting on TB. The World Health Organization, as you have heard from Dr. Sagoi Moses, will also issue a call to action urging member states to accelerate the rollout of the new WHO recommended shorter duration oral treatment regimens for drug-resistant TB. I'm pleased to state that in Namibia, we have already started on this path and we have included WHO recommended all oral treatment regimens in our guidelines. We have acquired these medicines and they are available at no charge to all those who need them. The hard reality is that TB infection disproportionately affects persons in resource-constrained communities. This exacerbates the many socioeconomic challenges faced by these communities, rendering them more vulnerable. Factors such as undernourishment, poor living and working conditions, and access to other services have an effect on people who contract and develop TB and how they cope with TB treatment. Combating TB cannot be achieved by the health system alone. It requires firm political commitment at the highest level, strong multi-sectoral collaborations beyond health, and an effective accountability system. We need whole of government, whole of society approach in the fight against TB. We are here in Tsumkwe for a special reason. The Ministry of Health and Social Services is aware that this constituency is a hotspot for drug-resistant TB and reports the highest number of drug-resistant TB in the country. I assure the community here in Tsumkwe and surrounding areas that our ministry is committed to addressing the #1 health crisis in this community and at any other vulnerable community in the country. I would also like to call upon the community to be aware of the contributing factors to the propagation of TB. Poverty is one, but also there are some of the action which we take ourselves. That is excessive use of alcohol and also smoking. Smoking compromises the lungs, which are the primary affection of tuberculosis. And we are warned to shy away from those practices which do not promote our health. Health of each individual is not found at clinics and health facilities. Health of each individual is found in the homes, and that is where we should cultivate the practice of ensuring our health, so that there is a minimal need to go to the clinics for medical assistance. Yesterday I visited the Tsumkwe clinic in the company of the regional governor, the regional councillor for this constituency, the regional and district health management team. I saw the progress we have made in this clinic, whereby, with assistance from our partners, GenExpert testing equipment has been acquired to diagnose TB at this clinic in Tsumkwe and the health center at MICT. These were the first health facilities in the country to get their own equipment. The results for these tests are almost instantaneous. A patient can have their sputum tested while they wait for the result. We have provided upgraded GenExpert equipment to do other tests and detect pre-XDR TB. Tsumkwe was the first area in this country to offer treatment to patients with drug-resistant TB without hospitalization, and we can attest to the commitment of the local people to take their own medications. Additionally, we have conducted door-to-door screening for TB in this community. In 2021, for example, we reached 8,964 community members and picked up 89 new people with TB. 73 persons were on treatment at a time. And last year, we reached 1,900 community members and picked up 42 new patients with TB. Our efforts did not only confirm that there are many cases of TB within the community, they strengthen our resolve to end TB among this community.
TB is curable, but to get the message to the minority, to the lives that we are losing, that is the most difficult part. I urge you to support me, to support the dying Namibians, to give me the authority to talk to people in the villages, in the closed bars, in the jail cells, in the system. I want to tell them that TB is curable. And if you are on TB treatment, complete it. I have done my due diligence. It is up to you, General. Mr. Teacher, send back.